Hi, I'm Dr. Vinatha. I'm a senior consultant in Cloudnine Hospital, Hitech City branch in Hyderabad. So nowadays, the videos are so much on. So many people would have seen video of a cesarean section. But let me explain that 7 layers it's true. Like there are layers that you have to go through women's body to reach the baby. So what are those? Let me explain. When we are taken to theatre, we clean and put the drapes. So we use an antiseptic solution to clean the tummy, and we use sterile drapes to cover the women, or except the tummy where you have to open. And we go just above the pubic bone. These days, a very nice, neat scar, but the size of the scar is almost to size of the head. So it's around 10 centimeters. Baby's head diameter is the measure for us. So around that much incision or the cut we have to make. So we will do the cut just above the pubic bone. It's also called bikini line incision these days. So it's very cosmetic at the same time. This is how we have been used for over the years. Years before, like 30-40 years before, we used to do an up and down cut from navel till the pubic bone, which is almost very, very rare these days. There are still 1 or 2 indications that we do up and down, but most of the time, 99.9% of the time, we are going bikini line. So what are the things that come under our way? Like first thing is we'll make a cut on the skin, and what is under the skin is the fat. So we'll go through the fat. Fat is easy. You just stretch it and it'll be fine. And then there is one layer which is white and glistening, and that is very strong. It's called rectus sheath. It's like a sheath. It's a ligament-like structure, and that is the most common thing that protects the tummy or the bowel contents not to come outside. So that is a strong one in our tummy that you have to go through. It's called rectus sheath. So you have to cut most of the time, and right under the sheath is the muscle. It's called rectus muscle. There are 2 strong rectus muscles in our tummy. When they are together, the support is good. So those you see people with 6-pack and everything, it is all those muscles. That's called rectus muscles. You don't have to cut that muscle. In the middle, there are 2 muscles side by side. So we go in the middle and just stretch it, and we can enter inside. Inside the tummy, it's like a balloon-like structure, like paper-thin structure that walls off all the layers, like a very thin cling film-like structure. We call it as peritoneum, and inside that will be the intestines, uterus, bladder, everything will be inside. So once we make a small cut in that cling film-like structure called peritoneum, I can see the uterus. But as soon as you see the uterus, you cannot cut it because the bladder is like a fold in front of the uterus. So what we will do, we will cut that layer also and separate the bladder away from the uterus. Then we make the cut on the uterus. So if you really count, this is the 7th layer, that's the uterus. So once we cut the uterus, then that's the bag of membranes, and from there the baby comes out. So these are 7 steps.